over to you.
Thank you very much. I'm very pleased to be here. The term evidence has a whole new meaning for me in the work that I'm doing now with criminal justice policy and research, because for many years I was a prosecutor. So evidence was the plastic bag of drugs, the gun, and I have a much more nuanced understanding of what evidence is now. My agency, the Office of Justice Programs, helps state, local, and tribal governments across the country deal with public safety issues and try to prevent crime, kind of in a nutshell. And it's a very broad spectrum because the criminal justice system encompasses many, many issue areas. So at the Office of Justice Programs, we work in all of those issue areas, trying to help communities become safer and healthier places for folks to live. And we have, since 2009, put a very special and heavy emphasis on using evidence to inform our programs, our funding, and so on. People sometimes think of the Office of Justice Programs as the ATM for criminal justice policies because we are a grant-making agency, but that is just a very small part of what we do, in fact, and where the major emphasis is. We realize that in helping communities with their criminal justice issues, it's our obligation, really, to gather evidence, to assess evidence, and to disseminate it, and to help communities translate that into practice. There isn't enough time, there isn't enough money in this world to spend on approaches to violence that don't work. And it's so important for communities to have access to knowledge about what has been evaluated. What does the statistical evidence tell us? What do the researchers tell us about what works in any given area of the criminal justice system? And I think that that's the most important role that the Office of Justice Programs plays. We have two components in the Office of Justice Programs whose mission is specifically to gather this kind of evidence and data and disseminate it. And that's the National Institute of Justice, where Katrina works, and the Bureau of Justice Statistics, which you read the New York Times, all those crime stats come from BJS and National Crime Victimization Survey and so on. That has been their mission from their inception. But since 2009, we have made a concerted effort to infuse a respect for science and evidence-based approaches throughout the Office of Justice Programs. So even in grant-making programs that work primarily with law enforcement or with victim services and so on, because they all need to be working along the lines of things that we know are going to make a difference. Internally at the Office of Justice Programs, we've formed what we call the Evidence Integration Initiative. And really our goal is to make sure that every single person who works at the Office of Justice Programs gets this and understands the importance of evidence. We have three major objectives, and one is to improve the quantity and the quality of the evidence that we generate through our own research, through evaluations of our programs and so on. And the second is to integrate that evidence more effectively into our own policy decisions and our program decisions too. For instance, what are we going to fund? What kinds of solicitations are we going to put out on the street in the next grant cycle? All of those kinds of questions need to be informed by the research. And then the third is to improve the translation of that evidence into practice, into our own practice, and to help people in communities translate evidence into practice. Well, what does that mean? That means that we are responsible for gathering the evidence and disseminating it in digestible format. Things that the local mayor or the police chief can understand, that it's accessible, and that we engage through our technical assistance, through our publications and so on, in explaining and in helping folks to understand the relevance of the science to what they do in, for instance, keeping police officers safe. Did you know that the evidence shows that this particular type of technology would help keep an officer safe on the street at night? Things like that. They're very, our constituents need research at a high level, but they also need very practical, down-to-earth solutions that are informed by that science and informed by that evidence. Excuse me. Katrina's unit, the National Institute of Justice, helps us by evaluating the programs that we do fund. And one of the ways that we work in communities is to seed programs that have great promise, provide seed funding, evaluate, and then once we know whether they're working and why they're working and what doesn't work about them, bring them up to scale. This is a really important way in which we disseminate these kinds of practices. One of the challenges that we have, of course, is we want our programs, we want our funding and so on to be evidence-based. And we actually have a database called crimesolutions.gov, which is one of those best practices kinds of databases, which Phelan Wyrick will speak about later today. So you're the mayor in Indianapolis. You could go on crimesolutions.gov and say, I don't have a problem with youth gangs. And I don't have a lot of time to research this myself or to read the studies, and I want to know what's worked someplace else so that I won't waste a lot of time spinning my wheels. And you go on crimesolutions.gov, and there are about 240 programs on that website now, which range across the whole criminal justice spectrum. And you'll be able to find the programs that have been evaluated by a group of experts, and it will show that they work. There's evidence that they work. They're still they're promising, or there's not enough evidence yet. And this has been a really great tool for us in trying to help folks translate evidence into practice. And I think I'll just say a couple more things and then we'll move on. But two questions that I have and two challenges I think for my agency are, how do you ensure that you're encouraging evidence-based practices and that you're, especially through your funding, and still encourage innovation? Make sure that new ideas are constantly growing and that there's room for that. And secondly, how do you evaluate, how do you do the cost-benefit analysis of these evidence-based practices? That one, in my view, is a very tough nut to crack. So thank you.
Thanks, Mary Lou. You heard Neil. I want to just summarize a simple way to think of some of the things that we heard. And you heard Neil talk about surveillance and that it's so important to get countries to do surveillance and collect information. And I think you've heard people talk about using evidence to answer 4 big questions. Then I would simply say those questions are, what's the problem? How big is it? How many children are involved? How many women are sexually assaulted who come to our HIV programs? When does it happen? Where are they? Who are they? Are they the poorest of the poor? But what's the problem? That's one question for which we need evidence. I think the second question we heard are, what are the causes? Jerry was talking about risk and preventive factors that might be common among different types of violence. What causes suicide to happen? What leads to child abuse? What leads to violence against women? And what prevents it? But we need evidence to answer that question. What are the causes? The third question you've heard here, and Mary Lou was talking about this, we need evidence to answer what works, what's effective. we don't want to be disseminating programs that don't work. And I wish I could tell you the number of times that we have put huge amounts of resources into programs that don't work. We talked about doctors. Doctors have done many things that don't work. We have many drugs that turn out not to work. We have many programs to prevent drug abuse that don't work. But this third question, the third area where we really need evidence, is answering this question, what works? And I think the fourth question, Jerry was talking about scaling up programs in multiple states, is once you have an intervention that works, how do you scale it up? How do you apply it? How do you implement it? How do you disseminate it? But I think these are four areas where you've heard we really need evidence. It's critical in the work that we do. We need more evidence and better evidence to answer all four of these. I want to ask our panelists to comment on the question. Mary Lou raised the term challenges in using evidence. What is the biggest challenge you have faced in the work that you have done in gathering or using evidence in your work on violence prevention? The single biggest challenge you have ever faced? And let me just ask you to think about that, and then we'll give each of our panelists a chance to answer that. Neil?